Hello, my name is Joshua Adams, and this is my presentation 2 for PC 2500. For my presentation, I'm going to be talking a little bit about the history of cancer treatment and diagnosis. We're going to be talking about things like what cancer actually is. We're going to talk about why there isn't a cure for cancer, how it's different from person to person. We're going to talk about what people in ancient times, specifically ancient Egypt and medieval times, thought about cancer and how they treated cancer differently than we do today. And finally, we're going to talk about how we treat cancer today and how vastly we've improved on the cancer treatment techniques of the past. Okay, so before we talk about how cancer is treated today and even how cancer was treated in the past, we need to talk about what cancer actually is. So, cancer is a violent disease that affects millions of people worldwide. And the big problem with cancer is that it's different from other diseases. It's also part of the reason why we don't have a cure. The way that it's different is it's your own body attacking you. It's not an outside source that attacks your body. It's a malfunction of your cells, and it's hard to fight your own body, and it's what makes cancer one of the harder diseases to cure. Okay, so we're going to talk a little bit about how cancer actually works. So what happens is you have the cancer cell, and so the human body is made up totally of cells, and sometimes these cells can go haywire, and when that happens, they become cancer cells. So cancer is a malfunction of the human body at the cellular level. So cells have this thing called a tumor suppressor gene inside of them. And what this gene does is it prevents the cell from growing out of control. And when this particular gene malfunctions, it causes the cell to grow rapidly and multiply at an accelerated rate. And this can cause the disease to shut down different parts of the body, and it spreads from anatomical system to anatomical system, and it just wreaks all kinds of havoc. So the reason that there isn't a cure is that cancer is very different from person to person. It's no one disease. It will affect every person differently. If I was to have esophageal cancer and someone like my friend Bob was to have esophageal cancer, we may face very different symptoms. Mine could be life-threatening and his could be harmless and not require any treatment at all. So there is no such thing as a cure for cancer as a whole, but there are specialized treatments for individual types of cancers. So much of what we know about cancer we've learned in the past 100 to 150 years. The ancient Egyptians actually believed that cancer was a curse from the gods and that it couldn't be cured. Whereas during medieval times, people believed that cancer could spread from person to person, which today we know is just not true. You can get cancer from all types of sources, but it's not infectious. It doesn't spread from person to person. There's been many theories as to how it works, and honestly, we still don't know specifically what causes any one person to get cancer. It's really just almost up to chance, but there are some things that will increase your probability or your chance of obtaining the disease, such as smoking for lung cancer, or radiation can cause lots of cancers. So, with a great and terrible disease comes great strategies to try and prevent it. Cancer treatment is a wide topic, and so I'm just going to talk about a couple specific things. Cancer cells and tumors have to be completely removed or killed from the body, or else the cancer will return. And in most cases, we are never able to actually remove every cancerous cell from the body, but we're able to remove enough that it doesn't come back fast enough for it to actually cause any real harm to the person. So the biggest challenge that oncologists, which are cancer doctors basically, the biggest challenge that oncologists face is removing the cancerous tissue without harming the healthy tissue inside of the body. And sometimes the cancer treatment can actually cause more damage than the cancer itself. So we spend years perfecting different types of treatment and different ways to get that cancer out of the body. So some of the earliest types of cancer treatment involved removal of the tumors or cancerous tissue through physical means, and this is, of course, through surgery. For many years before the 20th century, this was the only method of cancer treatment, and it led many physicians to believing physicians believed that cancer was incurable and treatment would only elongate the suffering of a patient. So we really didn't have much we could do for several thousand years. So with great advancements in the medical field, we were able to make advancements with the surgical removal of tumors as well. And one of those great advancements was the development of anesthesia. I know I, for one, would not want to have surgery while I was awake. And so anesthesia provided the ability to put patients to sleep while performing surgery on them. And this allowed for a great improvement in cancer treatment through the surgical removal of tumors. So radiation therapy is widely what's used today. It was developed in the 20th century, which may come as a shock to you, the early 20th century. So it's been around for about over 100 years now, and it's still what's used today. So that's rather surprising. It's really the best and most accurate way to treat cancer nowadays, just because it eliminates much of the possibility for human error, such as in the surgical removal of tumors. So let's talk a little bit about that. So how does it work? This actually right here, this is a mask that my dad is a radiation therapist, so he works with masks like these every day. And what happens is they have to make the mask fit to the person so that when they're placed on a table, and when they're placed on the table, they have to stay still because this type of treatment focuses a beam of concentrated radiation at the infected area on the patient. And so if the patient doesn't stay still, the radiation could go to a place that would cause them more harm than good. They want all the radiation to go to where the cancerous tissue is. Healthy tissue can be affected, but in most cases, if the treatment is performed properly, it's the best chance that the patient has. So in conclusion, we're learning new things every day about cancer and how it should be treated. Radiation therapy is still the most widely used type of treatment, and there's been many improvements in the past 40-50 years due to advancements in technology, specifically in computer technology. We're able to use computers to tell a radiation machine where to shoot the radiation on a patient, and this further eliminates the chance of human error. And there are many new types of treatment being developed today, such as proton therapy, which shoots protons at the patient instead of electrons, which is used in radiation therapy. But in the end, we're making great advancements, and we've come from, it's been a long road. We've come a long way in the last 2,000 years, specifically in the last 150 years. And hopefully there is a lot more to come. And here are my sources. So that is going to be it for my presentation. Thank you very much.